Hi, this is Michael Woodika for WVVH Hamptons Television. Hi Bradley, how are you?
Cold.
You're cold. What time did you get out here this morning?
Like 4:50, 5 o'clock.
Right. And what number are you?
63.
63. Well, it's been a long morning. Well, tell us a little bit why you're here today.
I gotta get a new pair of glasses.
Yes, well, set up beautifully in there. There's a lot of glasses, a lot of things. It's a little rainy. We got unfortunately cheated a little bit today.
That's right.
Yeah, where are you from?
Buena Vista.
Buena Vista. And then how long have you been out here this morning?
Probably an hour and a half.
Yeah, and so what are you here for today?
Optical.
Optical? How did you hear about RAM?
Through this place I go to every day. A piece of paper come through.
Now, Stan, you are the guy that actually started RAM.
Well, that was something like 27 years ago, and I think this is expedition number 661.
Right. Congratulations. What gave you the insight in order to want to start something like this?
Well, that's rather a long story, because that goes back to something like 1950 and a wild horse called Kang.
Okay.
And so it's a wild horse that nearly killed me that brought me here to do what we're doing today.
Great. Now, 661 over how many years?
Well, I started it here in the United States in 1985.
Wow, pretty amazing. So you've helped thousands and thousands and thousands of people.
Well, it's now over 500,000.
Wow. It's been a long couple of days, hasn't it?
Well, you know, this is what we do. Expedition number 661, so we're used to it.
Right. Now, what are some of the places that you've gone to already? Some of the areas.
Oh, gosh. Well, of course, we've been actually coast to coast, and we'll be back in California in 2 weeks' time.
Right. How many different volunteers does it take to put on something like this?
Well, it can vary. I mean, this is a sort of a medium-sized event, and we'll probably end up with 300 or 400 volunteers, but at some of the larger events, it'll go as high as 2,000 or 3,000.
Oh my gosh.
Volunteers.
Wow.
Yeah.
Pretty amazing. With 2,000 or 3,000 volunteers, how many people would you see during those couple of days?
Well, the last time we were in Los Angeles, we saw just over 7,000 patients.
In 2 days?
Well, no, that was actually in 6 days. So we're seeing them at about the rate of 1,000 a day. Regardless of where we are at a large operation, it's pretty well maxed out at about 1,200 patients a day, because this is not just a screening, we're actually doing hardcore treatment. So there are dental patients up there that have been in the chair for several hours. So it takes a lot of work to do that kind of dental surgery and all the stuff that we're doing in vision. So we're pretty well maxed out at about 1,200 patients a day.
Right. It's really amazing what you do. Now, how do people get information about what you're doing and also contribute money?
Well, you know, this operation exists really on those $10 and $15 checks that the public kindly sends to us. We're a 501c3 charity. We do not accept and do not ask for any government funds, either from the federal government or the state government. So it is, you know, publicly supported. And that's the way it runs.
Do you have a website that they can get a hold of you?
Oh, yeah. Our website is www.ramusa.org.
Nancy and Wendy, you are the keepers of the gate.
We are.
Yes. So tell us, what time did you get here this morning?
We were here at 5:30 this morning, and we'll be here at 5:30 tomorrow morning.
Right. And how many people have you seen today?
We have seen almost 400 people today for a variety of services.
Right. And how long have you been volunteering for?
This would be our second expedition, but I also help them write grants as well. I'm just beginning that for them, so it's been about a year, I'd say.
Oh, nice. What field are both of you in, and where are you from?
Well, I'm a retired federal investigator.
Nice.
Been retired 8 years, and I'm enjoying volunteer work very much.
Great. And yourself?
I'm also retired, but I'm a writer and journalist.
Nice. How wonderful. So I'm glad I've never met you when you're in your first job.
Exactly. Many people say that.
Yes, absolutely. Absolutely. So, from the different types of people, does it seem like people are really appreciative? I know this morning it was tough. It was out in the rain, and people finally got in. Pretty inspiring, some of the people that come in. And
Everyone is gracious. Everyone is thankful to be here. They're very gracious, and it's an enjoyable experience all around.
I was lucky enough to work with Linda yesterday. You and I worked on a little bit on the medical kits.
Correct.
Yes. So what do you do here, Linda?
Today I'm working triage, and then when we finish with the patients here, I'll go over to dental.
Now tell me what triage is.
Triage, we bring the patients in, we get their medical history, their medications, we check their blood pressure and pulse.
Right.
And look for any anomalies that might send them to a clinic they hadn't planned on going to.
Sure. What are they doing at each one of the tables?
They're taking
all the vitals?
All the vitals, the
Right.
medical history, and
Then we have a table over here to the left. What are they doing over there?
They're taking blood sugar.
Blood sugar. To make sure it doesn't spike up or there isn't any problems.
To make sure nobody's over the normal limits.
Right.
And if they are, then we flag them and send them to a doctor.
Right, absolutely. And then where are you from?
I'm from Clinton, Tennessee.
And how long have you been working with RAM?
A little over a year.
Right. Pretty rewarding?
It is. It is. People will come up to us and tell us how much this has changed their life.
Right.
And that's just amazing.
Alex Carter, how are you?
I'm very well. How are you, Michael?
Now, I'm really fortunate to know you. You were the one that inspired us to come out here and help out in any way we can. You've been doing this for how many years?
This is my 6th year.
6th year.
Yep.
Now, tell us about RAM.
Remote Area Medical is a charity that's committed to bringing medical, dental, and vision care to people who either can't afford it, don't have insurance, or are so far away in rural areas that even if they can afford it, they can't access it. So Remote Area Medical is a mobile infrastructure, and it brings in all these dental chairs and these vision units, and it makes it's like a one-stop shop for people who aren't able to go and get their medical treatment done.
Now, yesterday, this truck pulls up. Wyatt and I are over here. This truck pulls up, and then all of a sudden, you've got like 5 rooms of medical stuff. It's pretty amazing.
Yes, it is. I mean, it's almost like a little circus, but you do a lot cooler things, I think.
Now, you got here yesterday morning. You stayed here all night, basically working. People started getting here at 1 o'clock, 2 o'clock in the morning.
Yeah, we had a few people who were here yesterday morning when we were setting up, and then a lot of people come at about 2:30, and they line up, and we give them a little ticket so that they can go get warm in the tent.
Right. Now, we've got medical people. How many dentists do you have here volunteering their time?
I believe we have 12. We have 12 dentists, and then I think 6 fourth-year dental students, which is great. I mean, that rounds out our dental unit really well.
Right. Now, then you have some other helpers, nurses, the assistants that help yank teeth.
Yes, we do. We have some dental assistants, we have registered nurses, we have dental hygienists. We've got a lot of cleanings going on to make sure people don't have to get their teeth pulled in the future.
Right. Your sister from Vancouver flew in.
Yes, AJ's here, and she's actually in the purple scrubs.
And working, pulling teeth.
She's pulling teeth.
Yeah, that's great. Now, you want to be a dentist,
I do. That's
so
my
for
dream.
any of those people who want to help put her through school, she's putting herself through school, want to give a hand, she's a great
oh my God.
person to take care of. So tell us a little bit about what sort of things you're doing here as far as extractions and those sorts of things.
Well, the biggest thing that people get done are extractions. They number more even than the fillings and the cleanings. A lot of people, if they have let their dental care degenerate to the point where it's so painful and they can't eat, it's actually just safer and healthier to extract them, especially if they don't have ongoing care, because if they get fillings and the fillings fall out, that can be very painful and very expensive. So we do a lot of full mouth extractions, both full lower jaw, upper jaw, and full mouth. And after that happens, as much as they've got, a sore mouth and it's kind of bloody and a little bit uncomfortable, the rest of their life is so much easier.
Yes.
They can get fitted for dentures, they can eat again, and what's, most importantly, they don't have anything in their mouth that's got cysts or abscesses.
And they don't do nothing cosmetic here.
No, well, you know what? Some things end up being cosmetic as a result of this. Sometimes we're able to, if you've got a front tooth that's been decayed and they are able to put a nice white composite filling on it, you can sort of restore your smile at the same time. And
yes, but
that's
they're not
really
here
handy.
for teeth whitening.
No, there's no peroxide here.
Right. Where are you from?
From Lexington, Virginia.
Lexington, and what do you? I know you're obviously here to get some dental work done. You've been in pain for a little while.
A little bit.
Right. So we're pretty fortunate. How long were you outside for?
I came here about 9:30 last night.
Wow. That's a long day.
Oh, I wanted to make sure I got first come, first serve.
Yeah, good for you. Well, you're in.
2 years ago when we were in Roanoke, so.
Gotcha. Well, we're glad that you're here and you got really good people. And then AJ, which I'm friends with, she's here going to be taking care of that side. And we got the best dentist. Shh, don't tell anyone. We got the best dentist right over here. So.
Sounds like it.
All right, we're going to let you get to work and we're going to take a couple of pictures and we'd like to chat with you afterwards.
Okay, thank you.
Dr. Brantley, where are you from?
Goldsboro, North Carolina.
North Carolina. Good. Now, is this your first time at RAM?
This is the first time at RAM. Four of my dental school friends are volunteering for RAM as well. One's here from Arizona today, Dr. Criddle over at the next chair, and then 2 more. We're going to the one in Bristol, Tennessee in April.
Nice.
But this is the first one, so I'm getting my feet wet.
It's so wonderful you take the time out of your busy schedule to take care of this.
Glad to do it.
Good. Well, thank you so much. Now, how many people do you plan on going through today?
However many they put in the chair.
Many as you can do. Right. Line them up.
Yep, I'll be here as long as they're here.
Great. God bless. Well, you have a beautiful smile.
Oh, thank you.
You were in a little bit of pain before you got here.
A little bit.
Yes. So you're not far from the area, about 15 minutes?
About 15 minutes into Lexington, the next town over.
Great. Now, do you know any friends that came here with you?
Oh, lots of family members too.
Right. Now, how important is something like this to the community?
I think it's a very vital part of our community. It's a shame that we don't have more dental work that can be provided with those with Medicaid, Medicare. I think it should be done to help.
Yeah, it's nice that the dentists come from all over the place. Also, RAM sets up. This was number 661, first clinic. So, Kevin, you're getting ready to have a couple of teeth removed, right?
Yeah, yes, sir.
Yes. How long have they been bothering you for?
I don't know.
Quite a while, eh?
How well?
Yes, absolutely. So, how long were you waiting outside?
Couple hours.
Couple hours. Been a long day, isn't it? You're excited about getting the teeth removed?
Yeah.
Good, Kevin. Well, we're just going to watch at the very beginning. I get a little wheezy, so I can't do it. Well, you're going to have our best wishes with you, okay?
Yeah.
All right. Thank you so much. Appreciate it.
All right. Okay.
I'm sorry, what was your name?
Gates Parker.
Gates Parker?
Right.
Nice to see you.
Nice to be here.
Yes, absolutely. How long have you been helping out with RAM?
This is my first opportunity, and I'm delighted to be here. I've waited a couple of years to try to find the time, and I'm not disappointed to be here.
This is basically the sterilization area. We're sterilizing all the dental instruments, and so she's taking them off the used dental tray and separating out the instruments, and then we're going to wash them, put them in the biosonic bath, and then put them in the autoclave to sterilize them, and then they go back out. It can be used for more patients.
It seems like a couple of teeth have been extracted. You want to tell us?
Yes,
what
we
those
had
are?
a lot of tooth extractions. RAM does a lot of those. So we take those off and we actually save the teeth because some of the dentists like to take them and use them at dental schools for practice and learning. So everything's recyclable.
Right. How many extractions do you see there?
Looks like about 1, 2, 4.5 maybe. Or some of the teeth have cracked. So 4. What would you say, Laura?
4 teeth.
The tooth collector. But it's good, so maybe the patients can feel like some of their teeth are going to help other people, so the help dental students can learn off some of these teeth, which is interesting.
Tell us a little bit about what you've been doing with RAM.
Well, I started volunteering, Michael, about 15 years ago, and when I started I was working full-time. I worked on Fridays and Saturdays, and it sort of got me. I began volunteering on clinics, going on expeditions, and then RAM encouraged me to retire.
Nice. And work with them full time.
So that in fact did happen, and I did go ahead and finally retire from my regular job and did join RAM.
Now you've had, we were fortunate to spend dinner last night together, and you have a very interesting career. Seems like you've had life calling of helping others, all the way from education, programming, and now with RAM.
Well, you know, as a matter of fact, I think it was that job with the city that that really led me into working with RAM, because I enjoyed it so much. And then when I was looking for something to do on weekends, and in our little weekly newspaper, there was a write-up about remote area medical. And I said, you know, they're only about 2 blocks away from me. I called and was very impressed when a man with a distinct British accent, our founder, Stan Brock, answered the phone. I went down for an interview, and I've been with the organization ever since.
Well, they've been really blessed to have you, and how many lives you've touched, and all the different people you've touched.
Thank you.
You so much. Really.
Thank you so much.
How long have you been with RAM?
I think I'm in my 7th year now.
7th year. What are some of the areas you've been to?
I'm pretty much a hillbilly guy. I travel up and down the southeast Appalachian chain mostly, but I've also spent a lot of time with RAM in New Orleans and the Gulf Coast area through Katrina, Rita, and our subsequent return trips back and forth.
Amazing. What do you do? What did you do prior to that, or what's your profession?
Well, I've kind of bounced around. I'm an old Marine. I've been in sales for years, but I had gone through a personal loss and found this a very rewarding way to put my life back in order and you know, be of service to others, and I've enjoyed every bit of my 7 years.
Oh, everyone's been blessed to have you from the area, right?
Yes, I am. I'm from Buena Vista. I attended school here at Southern Virginia University.
Right. And then how long were you waiting outside? When did you get here?
I got here at 4 o'clock in the morning, and I was there until 7, so about 3 hours of waiting outside.
And now you're in for glasses, correct?
Yes, I am.
Are you doing any dental work as well?
I already did that. I was there for about 3 hours.
And what did you get done as far as the dental?
I actually just got cleaning. I thought I was going to have cavities, but I didn't, and it was pretty exciting.
Oh, good for you.
Yeah.
If you don't mind me asking, how long has it been since you had a clean?
I actually was here 2 years ago, so I got my teeth cleaned 2 years ago, and I did have cavities then, but...
Well, good practice.
Yes.
Great. And then now you're here for a pair of glasses as well?
I am here for a pair of glasses.
Myra, you take care of everyone's vision, eh?
I try.
Good. Tell us what you do here with the optical area.
Actually, when they come from the doctors with their prescription, I actually decide if we can make the glasses here, if I have to do bifocals or make single vision and make 2 pair, or what kind to make, or if our outside lab has to make them.
Right. How many different frame options do they have?
Hundreds.
100, 300, 400?
I'd say.
Yeah, it's pretty amazing. So typically everyone, just about everyone that comes through here has an opportunity to leaving with improving their sight one way or another.
Correct, yeah.
That's great. How long have you been with RAM?
8 to 10 years.
How nice is that? You've helped tens of thousands.
Yes.
It's a good feeling, isn't it?
Yeah.
So what did you do prior to helping out with RAM?
I'm actually an optician. Worked in an
Oh, you're an optician?
Yeah.
How great is that?
How are you?
Good, how are you?
Good. I guess you got out here pretty early.
Yeah, about 1:30, I guess.
1:30, and you're here for optical, eh?
Yep.
All right. So you live in the area?
Well, I go to school here at Southern Virginia,
right?
But I'm not from here.
Where are you from originally?
Houston.
Ah, Houston, great place.
Yeah.
You don't mind if we follow you through the optical area, do you?
That's fine.
All right, great.
3 or 4 years ago, and I had lost my glasses a while ago, so I'm here today.
Now, you take college classes without any glasses?
Yeah, but I always sit in the front.
Makes it a little more difficult for learning, eh?
Yeah, well, sitting in the front is always good, but it helps be able to see the board. Yeah, I can see. How far down do you see the letters? I can see, I can actually see all of them. Are they all numbers? Or?
There's a couple of numbers down there on that one. I'm sorry.
Judy, tell us about your lab and what you're doing in here.
What we are doing is we're making glasses in the lab. They will bring us the prescription, and we will have a frame in that prescription. Deb will pull all the lenses here. We carry about 10,000 on the lab. They come down here and they put them on the auto lensometer to be sure that they're correct, and they set the axis according to the prescription. They go to the frame tracer, and then from the frame tracer it goes down to the blocker, and then the blocker, they put the block on it that lines up on the 3 dots that they're putting from the auto lensometer, which goes with what the prescription is. From there it goes back to the edger, and that's where they scan the tray, make sure it's the correct glasses, put them in, edge it out, put it together, check it, send it out.
And how long does it take from the time you get the prescription to the time it runs out the door?
If it's the first one of the day, 20 minutes. Right. If it's the 150th one of the day, 2 hours.
How many volunteers and opticians do you have in here?
Let's see. I don't have any opticians in here. I have an optech, and I have 1, 2, 3, 4. Everybody in here is a volunteer. 7, 8. Depends.
How great is that? How many lenses and glasses will you go through today?
We can do up to 300 a day. I think we're going to do about 2 1/4 today.
Oh, pretty amazing. How long have you been working with RAM?
4 years.
Oh, great. What do you do? What do you do prior to this?
I worked in a chiropractor's office.
Oh, good. So very much like eyes, right?
Oh, yeah.
Good.
Backs, eyes, same difference.
Tom, you actually drove the truck here yesterday.
Yes, sir. Yes.
Yeah, we were right behind you. You pulled in. We both got a little lost coming in here.
Yeah.
How long have you been with RAM?
This is March will be 3 years. This March coming up will be 3 years. And
now, from the driving the truck to unloading, you unloaded yesterday, and now you're working in optics. What else have you done with RAM?
I help with the dental, also as far as dental equipment, keeping it maintained. If they don't have somebody that volunteers to help set up, I'll go in and help set that up. We help develop a lot of and design a lot of the stuff that they're using in there, as far as the way the air is delivered and the filtration systems and things like that. So it's been a lot of fun. It's been a lot of fun helping design and build the stuff also.
Now, what I was amazed with yesterday, as you're unloading the truck, it just seems like you have a little bit and then a little bit more. It's one of those clowns that jump out of a little Volkswagen. There's so much stuff. How many different stations do you hold in this vehicle?
I hold 32 dental stations upstairs with all the supplies also that'll support 32 dentists at work for 2 days. And then we also carry some of the vision, a little bit of the vision equipment. Downstairs we'll have 10 enough to do 10 vision lanes to put 10 vision doctors to work, and we also can make, like Judy was saying earlier, about 300 pair of glasses a day once everything's out and we get this set up in here.
Right. Now, how often do you get to remote areas where you can't even drive this big of a rig and you got to do a lot of hauling?
Not very often as far as for us. Now, actually, we have a fleet of planes, and that's when they go to the remote
Michael,
area.
you and I worked briefly yesterday together in the rain, bringing everything in. Tell us what you do for RAM.
I'm a core volunteer. I help them down at headquarters, and I've done everything from help organize the dental room with sterilization and equipment, and then I'll help out in vision where I can. I've even helped them out in the hangar on the DC-3 at times with our airplane mechanic Larry.
Right.
So I basically help them wherever I can. I prefer to work in medical if I can, and I'm working volunteer registration during this clinic, and of course next clinic, well, wherever they need.
You've been with them, RAM, for a year or two.
Oh, yes, sir.
How long?
It's about my 6th year.
6th year.
Yes, sir.
Now, tell us a little bit about where you've gone with RAM that's been kind of interesting and different.
Well, we started out with them in Katrina. I spent a week down there in New Orleans with Katrina, and then this last year we went to the Sioux Reservation out in South Dakota, spent 2 weeks out there, and then Chicago, a week in Chicago.
Right.
And then, of course, all the local clinics around the Tennessee area.
Mm-hmm. Tell us a little bit about Katrina and what you did there, and how, I mean, it must have been so devastating to
extremely devastating. Everybody was so grateful for us being there, helping. We had our facilities where they put us up was a zoo. We was able to sleep in sleeping bags in a little compound next to the zoo, and we put our instruments out for dental. And during the night, the flamingos, anything that's shiny, the flamingos likes to go and get. So they jumped over the fence and got our dental equipment and started picking it around and scattering around. So we learned real quick we had to cover everything up overnight.
I'm Tammy Lone, and I'm
going to Dabney S. Lancaster Community College, and I'm becoming a massage therapist, and I'm a student at this time, and we are massaging people that's coming as a volunteer.
Great.
And sir, I am Gloria Lawrence, and I'm actually the program head for Dabney Lancaster Community College, which is the 770-hour course that Tammy is engaged in. And we're here at the Regional Area Medical Free Clinic in DV.
Now, you're from New York.
I am. I'm originally a Manhattanite, and my undergraduate work and my graduate work was actually done at NYU. And I'm a certified medical massage therapist, and I'm nationally certified. I'm a licensed massage therapist, and I'm also a complete complex decongestive therapist and a master Pilates practitioner and American Red Cross certified instructor.
You did that so well. That's amazing.
Oh, well. You know, it's that New York minute. You gotta get it all in. Yeah.
So tell us a little bit about how many massage therapists you have here.
Well, at this event today we have 9, but in the class currently in the spring semester we have 13. Yeah, so they're beginning the study as a 2-semester program. It's all day on Tuesday and all day on Thursday. And what we've done is we've increased the 500 to 770 hours because I serve on 2 committees on a national level. So we're really trying to increase the education for knowledge and skills and abilities.
Great. Now here, there's so many people that have never had a massage before. So this is a little different. How many people have you massaged so far today?
I'm not exactly sure. Quite a few.
Quite a few, eh?
Yes. Well, they have anticipated between Saturday and Sunday for there to be 900 to 1,000 people in coming to this event.
The greatest impediment that we face in providing this kind of care nationwide is that for some extraordinary reason, a licensed practitioner of the healing arts in the United States, whether it's a dentist, a nurse, or a chiropractor or a veterinarian, are not allowed to cross state lines to provide free care for the underserved, even though they have been educated at an accredited school, whether it's in Texas or whether it's in
So they can
Maryland.
get accredited from a different university. They practice in, let's say, New York, but they can't go to New Jersey or Tennessee to help out.
Exactly, with a few exceptions. Notably, in 1995, because of the work that Remote Area Medical does, the legislature in Tennessee passed the Volunteer Healthcare Services Act, and hundreds of thousands of Tennesseans have benefited from that, because when we hold one of these events in Tennessee, anywhere from 40 to 60% of the practitioners are going to be from places like New York or even California.
Right.
Illinois followed suit 2 years ago, same as Tennessee, and so did Connecticut. California also changed the law 2 years ago, but unfortunately they, instead of just passing the law like they did in Tennessee, they put it in the hands of the various boards to implement.
Right.
And so the boards have not implemented it. And so they've in effect shot it in the foot. So I've appeared twice before Congress in Washington on this issue, and many other times in front of Health and Human Services. Why can't they change the law so that any doctor, practitioner, can cross state lines to provide free care, and I must preface free care, for the underserved? Well, they say it's a states' rights issue. Okay, well, to get 50 states to do that is going to be way, way, way into the next century.
Correct.
So something has to be done. It'd make an enormous difference to providing free care if that was allowed, and also protect those volunteers from frivolous lawsuits.
Absolutely. That's a major concern, especially with the different litigation, the malpractice.
Right.
Well, thank you so much, and we're going to reach out, tell people, see if they can talk to the congressman, legislation, trying to have strictly free care crossing state lines.
You bet. Thank you very much,
Thank you.
Mike.
Appreciate it.
You bet.